This is the case of complete AV septal defect with ostium secundum ASD at the same time. As definition says, complete AV septal defect should have ostium primum ASD and inlet VSD. So both ASD and VSD. The ASD and VSD are very close to one another. You can see this image. This is ASD, this is VSD, ostium primum ASD and inlet VSD. Both sides of mitral valve and tricuspid valve are at the same level. So whenever you find this kind of defect, complete AV septal defect or partial AV septal defect, both mitral and tricuspid valves lie at the same level. This is the ostium secundum ASD. You can see ostium secundum ASD. Again ostium secundum ASD. Flow through ostium secundum ASD, mainly left to right. This is right atrium. This is left atrium. Follow left to right. Again the same thing. You can also see the flow through ostium primum ASD. That is flow left to right. You see the how complete AV septal defect looks. This is ostium primum ASD and inlet VSD. Right side of heart is dilated, more in size compared to left side. This is parasternal short axis view. This is aorta. This is main pulmonary artery, right pulmonary and left pulmonary artery. The most lateral one, this is right pulmonary artery, left pulmonary artery, and the most lateral one is the location of PDA. Whenever there is PDA, you will find PDA at that location. PDA is always most lateral of the branches coming from pulmonary artery. You see very small PDA in this case, red in color. Left ventricle chamber is D-shaped, suggestive of raised right ventricular systolic pressure. Due to raised right ventricular systolic pressure, IV septum is behaving like part of right ventricle. So whenever there is contraction, the right interventricular septum remains as such. So appearing LV appears like letter D. So D-shaped left ventricle always indicates increased right ventricular systolic pressure. Again you see this is the picture of complete AV septal defect. We have to look for AV valve regurgitation because that is one of the significant finding. Whenever you find significant regurgitation, then the operative indication becomes important and early also. So if AV valve regurgitation is significant, then early correction is needed in that case. If AV regurgitation is minimum, then you can wait. At the same time, whenever you find significant right ventricular systolic pressure to be raised, in that case early surgical correction is mandatory. As such, surgical correction before 1 year of age is very good thing to do, because once the pulmonary artery pressure is irreversible, then operation will not give any kind of help to the child. So before pulmonary artery pressure becomes irreversibly raised, operation is indicated. So operation is indicated within 1 year of age. So this is the case of complete AV septal defect with ostium secundum ASD. Very small PDA. AV valve regurgitation is very minimum in this case. This is the size of inlet VSD. The size of ostium secundum ASD. Thank you.